Acute myeloid leukemia, AML, is a type of cancer that originates in the bone marrow, where blood cells are produced. It is characterized by the rapid proliferation of immature blood-forming cells called myeloblasts, which interfere with the production of normal blood cells. Here's an overview. 1. What is AML? Acute indicates a rapid progression of the disease. Myeloid refers to the myeloid cell lineage, which includes red blood cells, platelets, and certain white blood cells, granulocytes and monocytes. Leukemia, a cancer of the blood and bone marrow. In AML, abnormal myeloblasts accumulate in the bone marrow and bloodstream, crowding out healthy blood cells and impairing their function. 2. Who is affected? Adults. AML is most common in adults, particularly those over the age of 65. Children. It can occur in children but is less common than acute lymphoblastic leukemia, ALL. 3. Causes and risk factors. While the exact cause of AML is not always clear, several factors increase the risk. Genetic mutations. Acquired mutations in genes like FLT3 and PM1 or SEPA are common in AML. Environmental exposures. Prolonged exposure to benzene or other chemicals. High-dose radiation exposure. Previous cancer treatments, chemotherapy or radiation for other cancers. Blood disorders. Conditions like myelodysplastic syndrome or myeloproliferative disorders. Smoking increases the risk due to carcinogen exposure. 4. Symptoms. Symptoms develop quickly and are related to reduced levels of normal blood cells. General symptoms: fatigue and weakness, fever, weight loss or loss of appetite. Blood-related symptoms: anemia, pale skin, dizziness, and shortness of breath. Infections: increased susceptibility due to a lack of functional white blood cells. Bleeding or bruising due to low platelet counts, leading to nosebleeds, gum bleeding, or petechiae, small red spots on the skin. Bone pain from the accumulation of leukemic cells in the bone marrow. Swollen gums or skin lesions. Infiltration by leukemia cells. Enlarged liver or spleen, sometimes observed in advanced stages. 5. Diagnosis. Diagnosis involves a series of tests. Blood tests. Complete blood count, CBC, showing increased white blood cells and decreased red blood cells and platelets. Peripheral blood smear revealing immature myeloblasts. Bone marrow biopsy confirms the presence of abnormal myeloblasts. Cytogenetic and molecular testing identifies chromosomal abnormalities such as translocations, e.g., T821, or mutations, e.g., FLT3 and PM1. Flow cytometry identifies specific markers on leukemia cells to classify AML subtypes. 6. Treatment. Treatment is intensive and depends on the patient's age, overall health, and genetic markers of the leukemia. Induction therapy. High-dose chemotherapy, e.g., cytarabine and anthracyclines, to destroy leukemia cells and achieve remission. Consolidation therapy. Additional chemotherapy or stem cell transplantation to eliminate residual disease. Targeted therapies. FLT3 inhibitors, e.g., midostaurin for FLT3 mutated AML. IDH inhibitors, e.g., ivosidenib for IDH1/IDH2 mutations. Supportive care. Blood transfusions for anemia or bleeding. Antibiotics or antifungals to prevent infections. Bone marrow transplant for high-risk or relapsed cases, often using stem cells from a donor. 7. Prognosis. Prognosis varies based on factors such as age, genetic mutations, and overall health. Favorable genetic changes. Higher remission and survival rates. Older patients or those with high-risk mutations. Poor prognosis due to treatment resistance or inability to tolerate intensive therapy. Relapse. AML often recurs, requiring further treatment. 8. Complications. Immediate. Severe infections due to neutropenia. Bleeding complications. Long-term. Relapse of leukemia. Treatment-related side effects, such as organ damage or secondary cancers. Key differences from ALL. Cell lineage. AML involves myeloid cells, whereas ALL involves lymphoid cells. Age. AML is more common in adults, while ALL is more common in children. Prognosis. AML generally has a poorer prognosis compared to pediatric ALL, but targeted therapies have improved outcomes. Early diagnosis and treatment are crucial in AML due to its aggressive nature. Ongoing research is improving targeted therapies and outcomes for patients.